Unlike bowel cancer, we didn't know how many cancers were related to Lynch syndrome in gynecology, specifically womb cancer. So we undertook a search of the literature. That meant that we looked at all the information that was already out there, and we found that there was problems with a lot of those studies and that the answer wasn't clear.
So we decided to do the first study of its kind in the UK, where we looked at every woman with womb cancer who came to this hospital over a 2-year period and tested them all for Lynch syndrome.
The tests for Lynch syndrome are at 2 levels. One is on the tumour itself, and those tests are either done by immunohistochemistry, a big word for basically staining tissue, or it's done by something called microsatellite instability, which is a very clever test that tells you about the characteristics of that tumour. And once you've got that information, which we've done on all our tumours, which is quite comprehensive, we can then identify those individuals that need to go on and have germline testing. That's a blood test to confirm the presence of a mutation that could lead to Lynch.
We were able to say exactly how many womb cancers are associated with Lynch syndrome, and that was the first time that such a study had been done so comprehensively.
We found that just like bowel cancer, it's about 1 in 30, which really brings it home to the fact that there aren't many differences between bowel and womb cancer, so why isn't womb cancer involved in the current NICE guidance?
The reason why it's important to diagnose Lynch syndrome in women with womb cancer is because it's often the first cancer that somebody with Lynch syndrome will get. And the important thing about womb cancer is it's actually a really good prognosis type cancer, so we often cure womb cancer. So if we don't test that womb cancer for Lynch syndrome, that patient might never have the opportunity to know that she has Lynch syndrome until she goes on to develop her bowel cancer, which unfortunately has a much worse prognosis. So not only will it allow us to put in place surveillance and screening for bowel cancer for that particular woman, but it will also allow us to test her family members. And so we can find out, if there are other members of her family who also could benefit from screening for colorectal cancer specifically.